All right. Hi, guys. Thank you for coming back. And we are excited to talk about another service that OneWell Healthcare does for our community. Lindsay Dragon from Parenting Autism United, and we have our OneWell team who's going to start talking soon. We did follow up on segment that we did last week where we talked about overview of services that OneWell provides, and now we're going to be focusing on the waiver portion of that. And just because there's so much that goes into it. So I'll ask you a few questions throughout the thing. We only have one question that was submitted ahead of time, and then, we'll just keep going. So without further ado, Cynthia, would you like to start?
Sure, absolutely. My name is Cindy. I work for OneWell. I've been here for about 4.5 years, and I'm our regulatory and compliance manager.
Awesome. Thank you. Brandon, tell everyone who you are.
Hello again. My name is Brandon Cherry, Director of PAIDD at OneWell. I've been here for almost 4 years at OneWell Healthcare.
Cool. Now it's on to Laura.
Yep. Hi, guys. Laura McBride, Executive Director for OneWell Healthcare. Been here going on 5 years.
Awesome. All right. Well, let's get into the nitty gritty. Waivers. People thought I was talking, by the way, about picketing. They thought we were going to wave flags. I'm like, no, that's not what we're doing. And I had to double check the spelling.
Just as a side note, before we start, Cindy has the waiver Bible by her bed at night, and she reads the chapter before bed every night.
Hey, my Bible here is my schedule, my planner, so I get it.
Yep.
Just some light reading.
Some light bedtime reading.
Yeah, it's sad though that people had that interpretation, Lindsay. That they're not familiar with the waivers or what they are. It just shows that there's a lot of education needed.
Yeah. So it's just a confusing topic overall. And then once you start talking about it, a lot of people just get, oh, it's too much. They get overwhelmed, and then they take a break. And then by the time they go back, it's either too late or, not enough. And there was one other question, and it was about how the different counties do things. And I know we've talked about that in the past. So we'll
we can touch on that.
We'll talk on referrals and counties. All right. Okay, Cindy, take us away. Calgon, take us away.
I'll start off with what a waiver is. I'm also going to touch a little bit on what supports coordination can do for people and how to get one if someone's not already connected. And if maybe they're not super happy with the agency that they have, how they can maybe go about and get a new one in there.
Perfect.
So basically, for lack of a better word, a waiver is a pot of Medicaid funded dollars. Where the term waiver actually came from was back in 1981. There was a Social Security Act that came about around the time that Pennhurst was closing, and it allowed for the federal government to waiver certain Medicaid regulations that pot of money that used to be more for institutionalized care can now be administered in more like a personal home or someone's community. So that's really where that term waiver had come from.
And the way, real quick, the way that somebody explained it to me years ago, and if this is the way a lot of us who had gone through one of these trainings in the past, was the state has to have money for individuals who need to be institutionalized. And back in the day, that was what had to happen. Right. So the state has that funding already, but now that people are no longer being institutionalized because those were deemed obviously unhealthy, unlawful, and a lot of things, horrible things happen there, but also education has come a long way. Now that funding, instead of being there, is now put into these waivers. Is that a similar? Okay, just a different perspective.
Yes, that's exactly what it is.
Okay.
Yes. Thanks. So for Pennsylvania, there are 3 different waivers. I know I touched on it a little bit our last session as well. We have our person family directed support waiver, or PFDS, much easier to say it that way. And that has an annual cap of $47,000 of different types of services. And now, mind you, the 3 waivers can cover, so to speak, every service that's listed underneath each waiver. It's just a matter of how much they cost, for lack of a better word, if it's going to fit within that specific waiver cap. Our second waiver is our community living waiver. That's kind of a newer one that came out in 2017. So it hasn't been around too terribly long. And that has an annual cap of $97,000. And then what we also call the golden ticket waiver, or is the consolidated waiver, or the con waiver. So that has no annual cap on services. If you see someone, or if your loved one is getting a consolidated waiver, it could be maybe because their needs are much greater, whether it's behavioral health needs, whether it's medical needs, or maybe that person wants to maybe live as an adult, wants to live outside of mom and dad's house, and maybe wants to live with some friends, or in a group home or something like that. So unfortunately, the consolidated waiver can be a little bit harder to get because of those reasons. But all of them do cover the same services. How someone would get one of those waivers is, it's kind of a multi-step process. And that's also where someone's supports coordinator comes in place. So someone would have to be connected with a supports coordinator to be able to apply for any one of these three waivers. And when someone is applying, so to speak, for a waiver, they're not just they're not checking off, I want PFDS, I want, consolidated. It's really just one application, and it's called the DP 458, or a service preference form. I'm not, some people might be familiar with that or not. But that's kind of the first step that somebody would need to do, assuming they have a supports coordinator, to be able to apply for those waiver services. You can apply at any time. You can apply when your child is 5. You can apply when they're 15. Unfortunately, it may not mean that you'll get one of those slots until they are further along in their age, approaching graduation time, or maybe there's a major life change happening where somebody would need those supports and services to be able to, be maintained safely at home or in their community. But most likely it is going to come as they're approaching that graduation age.
Well, and service coordinators are not service providers. And then the only way to get a service coordinator is to start by applying through MHDS. Is that right?
Correct. Yes.
So that's really your first stop is MHDS, and then they'll do your intake and then get you a list of service providers that you can then go with. And then that's it, right? Is that
Yes, that's
how
exactly.
I'm understanding it? Okay, great.
Yeah.
I'm on the right path then.
Yeah. If someone does not have that sports coordinator currently, that would be their first stop. They would just count whatever county that they reside in. It would be that MHDD or MHDP. They'll have slightly different acronyms, but they're all the same thing.
Okay.
But yes, that would be their first stop. They would call and they would say, I want an intake for a supports coordinator. And then that intake worker would take down their information. They'll also give you probably a fairly long list of information they'll need too. So it could be if there's any full-scale IQ testing. There may not be, maybe depending on the person's age. If they're, under 8, typically you're not going to see a full-scale IQ yet, which is fine. They'll ask for, IEPs, reevaluation reports, any kind of doctor and medical reports that they feel might be helpful. They're going to ask for a lot of stuff. And then an intake team is going to review that, and they're going to say, yes, this person qualifies for supports coordination, or no, this person does not qualify for supports coordination. And I would always tell families, if you're turned down for it, don't take it as I definitely can never get a supports coordinator. You do have the ability to appeal that decision. So you can file what's called a fair hearing. You could do what's called an administrative county meeting, and you can maybe come back with some additional documentation, maybe get that full scale IQ report if that was not submitted initially. So don't take a no as a definite no. Just know that you can appeal that decision.
Great.
And then also 2 other things that one is new, one is fairly new. So it used to be, to qualify for a supports coordinator, it was that IQ of 70 or below. That part of that changed back in 2018, where someone just with an autism only diagnosis could potentially qualify for a supports coordinator and for all those 3 waivers underneath it. They don't have to have that IQ cutoff so to speak. They would have to have testing done that does indicate deficits in a couple different areas of their life domains, like, communication, socialization, so, safety skills. So again, if a family is kind of on the fence, like, oh, I'm not sure if my loved one would qualify, the worst thing that happens is that you go through the intake and maybe go through an appeal and they're still denied.
Right.
But I just felt like, over the years, I met with some families that weren't sure if they would qualify and their son or daughter did. So
Great.
I would always encourage families to do that. And then another change, and this is fairly recent, I believe within the past year or so, that the third group that can qualify for a supports coordinator, again, not IQ dependent, is medically complex children.
Oh,
So
good.
if you
Yeah.
have a child that has such great medical needs that they are dependent on technology to basically sustain their life, that person can also apply for a supports coordinator. And again, those same waivers. So those are kind of other caveats. It's not always that IQ cutoff for people.
Yeah. I haven't heard that one yet, so that's good information.
Yeah, that one was newer. I don't even know if it's a year old at this point. It might even be less than a year old. So yeah, that one's definitely a newer one. But once someone has that supports coordinator, and like Lindsay was saying, there's tons of agencies out there that do the same thing. They could be most of them are county-based. They might do all 67 counties. They might do 4, they might do 1. But that when you go with that county MHDP intake process, they'll give you a list of whatever available agencies are out there. So, and I would always try and encourage families, shop around a little bit, ask your
I was
friends.
just gonna say
Oh.
something like
Yeah.
that. I know a lot of people feel like they're stuck with whoever they started with.
Yeah.
And I kind of use that same mentality when you get, even just through your service providers, when you get a one-to-one, and you're getting services, but something is off. Your gut is telling you that something isn't right, or say somebody's just constantly rude to you.
Yeah.
You don't have to stay with that person. There are other options, and you should shop around, because that can only lead to more issues, right? If
Yes,
not a
absolutely.
good relationship.
Yeah, and someone doesn't necessarily have to completely change supports coordination organizations. They could just ask for a different supports coordinator. Maybe
Yeah.
they're just, people are people.
Right.
Personalities sometimes just don't click. So there's that option as well. But, I think a good thing for families to do is, like I was saying, kind of, shop around. It's, ask your friends, maybe your child's, teacher has some ideas or some off the books recommendations. And also don't be afraid to call those SEOs and ask to speak with the director, maybe one of the supervisors, and kind of think about what's important to you in
Well,
organizing.
and that's why I tell parents when they're getting their one-to-ones for the first time, and I'm like, you're interviewing them.
Mhm.
Like, they're there to help you. So if you have a stake in this, everyone has an equal stake in it.
Yeah,
So just not to think that those are your only options is really important to know.
exactly. And, think about what's important. Does it matter to you that the organization's been around for 50 years or 5?
Right.
Does it matter if they have, you know, 100 supports coordinators or 10? Like, it's just,
Yeah.
whatever you feel. And like you said, Lindsay, like, at the end of the day, it does go about, kind of your gut feeling. So, and, parents are going to be the best advocates for their loved ones. So they, of all people, should feel comfortable with the ones that they're working with in their home.
I feel like you always get better information from other parents just because it's a lived experience. But the most important piece of that is that is their experience.
Mhm.
And you can easily talk to, 6 people, and 3 of them had great experiences, and 3 of them would burn the place down if they could.
Absolutely.
So I mean, you really do have to test it for yourself and just realize that everyone is so different. You can't go off of exactly what they say, but it's nice to have as much information as possible.
Yes, exactly.
That was a little excessive. Not burn the place down.
Yeah, well, yeah.
Scratch that.
But yes, so let's say, once you have that supports coordinator, now that person's job is going to, well, they have a lot of different roles. They're basically going to be your main point of contact for any service that your loved one would need throughout the scope of their life. And it can be a lifelong service if you really want it to be.
Right.
So that's always going to be kind of I always kind of like compare it to a bicycle wheel, like your SC is in the middle and then all the services are around it, and then they're connecting you with spokes to all those services. So that's why it is important to start with that service, because that's really how you're going to be able to access the other ones. So once you have that SC, let's pretend that we all have SCs, and they're going to assist you with applying for waiver, for one of those waiver funded slots. So there is a kind of an application process that goes along with it. Like I said, there is a service preference form that's basically saying I'm choosing to use Medicaid waiver funding for home and community integrated services and not something in an institution. That's really all that form says. It's not
Right.
super fancy. It's only 2 pages. There is information that will go along with it because it is tied to that diagnosis of whether it's intellectual disability or strictly autism or the medically complex definition that has now been introduced. Whatever information that was used to first become eligible for a supports coordinator, that is also what's going to go along with that application. It's
So
also,
keep your stuff together. Keep
yes.
your stuff.
Mhm.
That's the big thing. Have everything ready, and that'll help everything go through a lot smoother.
Exactly, yes. Since it is a Medicaid funded service, someone would need to maybe not necessarily have Medicaid right at that moment, but be made Medicaid eligible.
Okay.
So for someone that's under 18, that would be through that loophole that they would be eligible. For someone who's over, it would be based on their own income. And then, of course, comes the asset limit of no more than $2,000 or $8,000, depending on what type of Social Security that they're getting. So that's the other piece. And they would need to have a current physical. Typically, your supports coordinator will supply you with a specific form because there's a magical little box that the doctor has to check off for you to also be able to qualify to even apply for the waiver. There's another step to applying for waiver, and that is called filling out a PUNS form, it's called, with the SC. It stands for Prioritization of Urgency of Need for Services. For lack of a better word, it's a wait list
Right.
waiver, but it's not in numbered order. It's based on need.
Okay.
So you have a couple different categories. You have your first category, which is emergency, which means I need waiver funding yesterday, or at least within the next 6 months. You have your critical category, which is, well, I need something, but not for 6 months to 2 years. Typically, when someone's closer to graduation or a couple months away from graduation, they'll be in on one of those categories because they're going to need some.
Yeah.
And then your last category is planning, which is kind of 2 to 5 years out.
Okay.
Someone that might have a caregiver that might be considered aging, that would be an appropriate category for someone to be on for the planning stage. So like I said, it's not based on numbered order. So you could be on emergency stage for 6 months, and that's a long time. And then someone could be added to that list the day prior, and whatever their situation is unfortunately could be considered more dire
Yeah.
than, what your situation is.
And I mean, there's no way to get around that. That's the way everything kind of works right now. I know a lot of service providers also are with the wait lists, it goes off of need.
Mhm.
And so you could be on the wait list and almost there, and then exactly that same thing happens. So
Yeah.
unfortunately, we should all be at least a little understanding, that it's going to be there, but we can only do what we can do with what we have, right?
Right. And I feel like that really ties into the importance of having that good relationship with the supports coordinator. And unfortunately, I do understand that there is turnover in that field, unfortunately. I always, you can always encourage families to not just maybe reach out to that SC and have that relationship, but also their supervisor. and maybe the director, because the odds of them moving or leaving is a little bit less maybe than a supports coordination position.
Every person in those roles right now is like, dang it, she just told him to call us.
Well,
Cindy,
But that's
Cindy has,
exactly
Cindy was a director for 15 years, so she probably is used to all those calls when SCNs
Yes.
leave, so.
I was very accustomed to those
Yeah.
calls, but you know,
yeah.
people want to, you know, people need to be helped. I mean, it's, you know, that's what I'm
And
there
that's
for
what
too.
it comes down to is these are our children, whether
Mhm.
they're adults, they're still our children, and we need to be here to help them. So, and we can only do that through you guys or through services. So,
Mhm.
it's very important to try to keep a positive relationship.
Mhm.
And then maybe not so many service coordinators will get burnt out, which is what is, I think, when you have somebody in your space and for only 30 minutes and for 20 of those minutes, they're just complaining about how big their caseload is. And, you're not really getting that quality time with them. So at that point is when I would say, you know what, let's just spread it out. Let's take a little bit off of you. Let's, go to the next person. So that's good to know, good to know.
And it's also important too, because like I said, since that PUNS list is based on need, and each county does review that list on a weekly basis. So it's not like it's this list that's just housed and no one really looks at it. They are reviewing that pretty regularly. I know I guess I can't speak for every county, but I know when, in the counties that I had worked in, when I was in supports coordination, they would reach out to us and they would say, who do you feel is more of a priority, what's going on with your folks on emergency, that way we were always able to keep them updated on what's going on. And that really plays into why it's important to feel comfortable with your supports coordinator, because they are going to be kind of the one that's,
They're the ones fighting for you.
yeah, they're the ones bringing that information. And it's not even always based on the needs of your loved one. It's also based on maybe family dynamics that's happening at that moment. Maybe, mom just got diagnosed with breast cancer, or mom and dad are getting divorced. Maybe their house is being foreclosed on. And, these are all very sensitive topics, and not everyone wants to just announce them to basically a perfect stranger that's coming in their home. But the more information that you are able to provide to really support the need for your child to get that type of level of funding, the better off you'll be.
Well, and I know a lot of people think that they can just say something. And, one of the things about we're seasoned in having our IEPs, it's you don't need to embellish, you don't need to underplay it.
Right.
Just state the facts as they are,
Mhm.
because that's the only thing that matters.
Right.
And especially when it's paperwork and then it's this relationship. But I mean, embellishing isn't going to do anything, but
Mhm.
underplaying is not going to get you anything either.
Right.
So
Exactly.
just having the facts, whittle it down, because everyone's time is precious too,
Mhm.
theirs included.
Yeah.
So basically get your shit together.
Right.
Like, have all of it ready.
Mm-hmm.
And and in these situations, the longer you wait, the worse it is.
Mm-hmm.
So that's good to know that a lot of those things that could also affect it. I wasn't aware of that. So
Mm-hmm.
good info
Yes.
to have. Thank you.
Yes. And then there's another thing too, and this is very specific criteria. Pennsylvania always holds a certain number of what's called unanticipated emergency waiver slots at any given time. I don't know how many there are. The number kind of fluctuates. So I couldn't even fathom a guess right now at this point. It's not like there's tons upon tons when you consider how many people, reside in the state. But if someone is, well, if a, an adult or a loved one that is receiving the services, if they are at risk of incarceration, that's considered an unanticipated emergency, because we don't want them in the justice system, certainly not. If someone is going to be homeless, will literally have no roof over their head for whatever reason, or the caregiver, their only caregiver, has passed away. Those three, if any one of those three things happen, then the supports coordinator can apply for what's called the unanticipated emergency slot.
And that's good to know. The people who say, "Oh, I'll do this later," it's like, well, you don't know when those things are going to happen. So it's very important to get this. So I've made one call, and now I'm going to be like, on it. Like I gotta follow up and finish my intake because he's 11, and I've just, like I said, I've done all this information, but for me to actually get it done, it's almost like I have this anvil on me and I can't move forward. But now I'm good, and we're gonna move forward. And so I'm going through it from the very beginning, and over the summer we'll keep everyone updated on that. But I never even knew that was another thing. So keep going. You're just hitting me with all this info. I love
I am full of facts.
it. Yeah.
Like Brandon said, I keep the Bible, the ISP and waiver Bible next to my desk.
There we go.
Yeah. I know we did touch on, I believe last time, the different waiver services that we offer. There's a whole host of other waiver services too that are available. So like I mentioned a little bit earlier in our talk, I mentioned about, housing. A waiver slot can provide funding for housing for someone that's obviously of age, 21 and over, and they want to, move out of mom and dad's house. And there's a couple different models. It doesn't have to be someone living in a group home. It can be if that's what they desire. Of course, there's very lovely group homes. That's one option. There's also something called life sharing, where someone with a disability lives with someone that does not have a disability. That person is hired by a provider agency. And so they're background checked, they are paid a monthly stipend to provide that care. It's a little bit more of a natural setting, which I think some people really, really like. It can be a family that they're living with. It could be a single college kid. It could be a married couple. It could be any sort of situation. It just depends on what the individual wants and what is comfortable
Well,
for them.
and I think a lot of people who have very high support needs, and this is kind of just alluding to all the stuff in the press and the media recently, a lot of those high support needs individuals being in a group home or a group facility is very different from being in an institution.
Yeah.
But
Oh, yeah.
that's where a lot of these waivers come from. These are, a lot of the individuals who are going to have those high support needs are definitely going to have waivers. We all know that because they have to have them to get through life.
Yeah.
And, but a group setting, sometimes it might be better. And this is just from seeing people who came into our office. Sometimes if the family can't relax and live in their home and lead a life because, of caring for their child, some of these settings can help take that stress off, which then can also help them be healthier and live longer, because we all know that can, when you're wearing down somebody who's in the field, they can easily just quit and go to a different thing. The families don't get that reprieve. So
Right.
understanding the waivers and understanding how all these services are here is one of the most important things that they could do. But when you say you have to educate yourself and do your research, is what everyone says, that in itself, I'm like, that's a little hostile, and I'm going to go now. Like,
Yeah.
so that's why we're hopefully going to be sharing more resources and touching on it again. If people have more questions, we'll keep going and doing more things. But it's important that they know that all these resources are there. So thank you.
And then another service, because I believe last week you had mentioned about someone using a taxi and it was cost prohibitive to get to and from work. There is a waiver service. It's called benefits counseling. And that it's basically someone wants to work and, wants to have a community job. Maybe they have some job coaching that they need to be successful. But the benefits counseling is there because there's a lot of, they're called ERWEs, impairment related work expenses. There's a lot of expenses that can actually be deducted off of their wages, so to speak, that they're reported to Social Security. That way, maybe their Social Security check that they still can't really fully live without, that's not going to be reduced nearly as much, because something like a taxi could be considered an ERWE. And just like things like that. So I think that's always a good service for someone if they're confused on Social Security, how it works, because it's not easy to understand. That's a good person to meet with.
Well, and we were talking a little bit, you were mentioning, different, counties do different things. And that was one of the questions that came across on social media from our last one is, how, I know that there are so many waivers, but it's through the state, but then each county has different amounts of things too, right?
Yeah. Yeah, so there's at any given time, there's so many waiver slots that are created available. And then the state takes them and they kind of give them out to each county. I don't know all the factors that go into it. Obviously, how many people are registered or how many people are maybe on their particular PUNS list. That is going to play some kind of a part into it. Bucks County might get more than, maybe like Elk County or something like that, just based on how many people are there. But yes,
And
each
then,
county has so many.
for example, if Luzerne County had, just say randomly, 40 waivers and they're all taken, the only way for somebody to get one of those waivers then is if somebody who is currently using them has expired,
Yeah,
right?
or has
And
moved out of the state.
or
Mhm.
moved out of state.
Yeah.
That's what I was like. That's the thing. And all of my previous things are like somebody has to die for you to get a waiver, and it's like, dude, chill out. Like,
Yeah.
you don't want to think about your child getting help because somebody else has died. Like
Mhm.
that was a horrible like presentation point.
Well,
um, but
unfortunately that does happen. Yeah,
well,
it's
of
a sad
course, I
fact,
mean
but
that's a natural
yeah.
circle of life. We've been watching the Lion King live actions over the last week or two, so I'm all about it. But they can move out of state. They could, that's a good, yeah, that's much better for my perception.
And ODP will do at times, they'll do what are called initiatives. So I know a couple years ago, they had like a graduate initiative, just because they had more graduates maybe coming through that year than maybe the year prior. There was
Okay.
one year they did an aging caregiver one, because again, there was a lot of people on that aging caregiver category in PUNS, and they're like, oh my goodness, there's a lot coming up. We need to plan. So then they
Yeah.
were, I don't know how all that budgeting and shifting works. I just know that there were additional waiver slots created and given to those folks that,
Mhm.
Yeah.
that were in that funds category. So,
Yeah,
um,
and some of the provider meetings and presentations that we've attended fairly recently, not within the last month, within the last 6 months or so, though, I would say there those AEs, those administrative entities, they're telling us that there are waiver slots available, and for example, they'll say we have 6 community living slots, we have 14 PFDS slots, no consolidated slots, but they are available. It's not like they're all completely depleted and you're on this wait list no matter what. They are available.
Yeah.
Um,
Well, and say somebody gets on one of the first 2 waivers that we talked about, but they really wanted a consolidated waiver. Once you get a waiver, any waiver though, so I have 2 questions in one. Once you get a waiver, do you have it forever? And then the second one, say you really need a different kind of waiver, but you already have one, can you change
you
down the
can,
line?
so once you have, let's say you have a PF waiver, but you really need it consolidated, that's not going to be your waiver for the duration of your life.
Okay.
There is an option to move into a consolidated waiver when comes available. So for that person, if they have a PF waiver, but it's not really meeting their needs, they can still stay on that PUNS list. They don't have to
Okay.
come off. Yeah.
All right. And then once you get it and say it's the right one,
Mhm.
do you have it until you don't need it anymore? Or
Um,
do you have to keep reapplying every year like you
oh,
do
no,
for
no, no. Once you have your waiver, you have it. I mean, you do have to, I guess, follow along with some guidelines, like there's something called a SIS assessment, supports intensity scale. When someone's enrolled in the waiver, they have to participate every 5 years. And
Okay.
that comes from Center for Medicaid and Medicare Services.
Right.
Every state has to have a reassessment every 5 years, so they have to participate in that. They have to make sure they're staying under that Medicaid asset limit. Because they
Right.
do have to, they have to reapply for medical assistance every year, which
mhm.
in turn kind of feeds into the waiver since it's a Medicaid funded program. So
Right.
asset limit, CIS participation, and annual physical. That's it.
Well, and just for anyone who hasn't heard of this in the past and they're just learning about all these things, any newly diagnosed families, et cetera, what happens with Medicaid and all of our services is, so for my son, for his social security number, he cannot be tied to funds more than $2,000. Now, that can include a beneficiary type thing where, say, we, pass away and we have his name as the beneficiary of our house. Well, those are the assets that you just mentioned. Like he owns something more than $2,000 attached to his name, and So they would stop services, right?
No,
No,
Medicaid
okay.
allows you, they allow a recipient a house and one car.
Oh, okay. Well,
So
okay.
you're
So
not,
say somebody left their life insurance policy was,
that's,
$50,000.
that would be considered an asset, and that
Yeah.
would need to be funneled somewhere else.
Well, and unfortunately, my father-in-law passed away a few years ago, and we didn't even know that he had things that had our children as beneficiaries. Now, it wasn't anything, obviously, and for our situation, my son is really young, and but if that had gone on for years, and then that money accrued, and we didn't even know about it, and we would have had to get rid of it
Yeah.
in order to keep services.
Mhm,
So that's something that I've learned through a few meetings like this, but also there's special needs financial advisors
mhm.
who can help you with those types of things. And we have resources for those as well. So when it comes to money, like it gets really tricky. And like you said, assets as well. So
Mhm.
those are kind of what we're talking about because it was mentioned a little bit earlier on with the $2,000 and then with the assets now. I just wanted to throw that out there in case anyone was wondering what that meant. But
Yeah, Lindsay,
Yeah.
we do have, we partner with a special needs financial planner, probably about quarterly, I would say, for a webinar on that topic as well. So when we have the next one planned, I'll be sure to get that to you and you can
wonderful.
hop on to.
Yeah,
Yeah,
there's
I mean, especially if that's not your profession, there's just no way that you would know.
Mm-hmm.
So it's much easier. Delegate. Get the information from the people who know what they're doing.
Yeah.
Yes, exactly. Yeah, because because they present on like special needs trusts, because like normally you want like a third party versus a first party, and then the able accounts that they
Mm.
present on. But yeah, but I do know that a house and one car is not considered an asset for Medicaid.
Oh, that's good to know.
Yeah.
Good.
Things to find out along the way. I don't even know how I
Right.
got there. Probably someone I supported had a house and a car. I don't even know.
Right.
And then the other thing too that, because sometimes I feel like I give a little bit of doom and gloom, like, oh, here's these great waivers, but I'm sorry, you have to wait a long time. There are other things that families could kind of explore, while especially when their kids are much younger. Um, there's something called, well, it's called EPSCT, but it's kind of like in-home care. It is through Medicaid as well. But if you have a loved one, they're getting home from school at 3 o'clock in the afternoon, but you don't get home from work until 6, and they're going to be alone in that time, and that's not a safe, good idea. They can actually, with their supports coordinator, write what's called a letter of medical necessity. There's tons of templates online on Disability Rights Network, on the Pennsylvania Health Law Project. They have great templates on how to write one. And it's basically saying, these are the unsafe things that could happen. Can my medical assistants approve to have a home health aide come in my home, 5 days a week for those hours at a time to provide, they call it custodial care. So it's not
Right.
necessarily like skill building per se, but it
We're
is,
just keeping them safe.
companionship and yeah.
Mhm.
Yeah, so that is an option for families too, which I think is a good one. Also, because I know a lot of times, like maybe folks want to send their loved ones to like camps or like some kind of
Right.
special equestrians, and some of them are expensive.
They're very expensive.
Yeah, each county does have what's called, each county calls it different, but either family-driven monies or family support service monies. It's not a huge amount. It might be a couple $100 up to 1,000, depending on what someone's financial needs are. But that is something that a supports coordinator can help you out with each year and get some of that money for some of those super expensive activities, just to offset a little bit of the cost. And then
Right.
there's something called the Achieve a Charitable Trust. Um, that is not financial based. And I forget exactly how they get the money for all these things. I don't know if it's grants or donations or whatnot. But if someone has like maybe even a greater need, like maybe they have a van that needs a wheelchair lift, but it's not cheap to get one of
Right.
those, that could be an organization that can help out with funding something like that. So there are some other things out there too. In terms of like families networking with each other also, so I mean, obviously something like this is great. And then each county has their own interagency coordinating councils that meets with other parents, that meets with special education educators think they
through the LIU and the ARC. We're actually part of that. So yay.
I always found them helpful. That's actually how I learned stuff, was going to those
Well,
meetings
yeah,
and
I
talking
mean,
to families.
and that's where you have to figure out what's going to work best for you. And if it's, somebody offers something the first Tuesday of every month, but you only work Tuesday and Thursday nights and you can never make those, you
Mhm.
just got to hope that there's more out there. And we get a lot of flack like, oh, there's so much autism stuff. Why can't you all just do it together and work together? And I'm like, okay, go to your podiatrist for your heart issue. It's very different. Like we have different needs at all different stages of life, and it doesn't stop when they graduate. And so many people just don't understand that kids with autism
Mhm.
grow up to be adults with autism. They don't understand. But one of the things I wanted just to throw out was with the waiver, when you get the money, you have all these services that you choose from. You basically create yourself like a menu, and you have to can you decide, I mean, obviously you have to decide which things to spend money on. How do you get the money, and then who monitors how you spend it?
So how you get, so the family isn't really given the money directly. It's all
Right.
done through the individual support plan. So when someone has an
ISP.
support coordinator, yeah, the ISP, everyone's gonna have an ISP. And
Right.
there's a section in that ISP where that SC just goes into the state system and they physically select the services to like
Yeah,
add
so
to
it's
the
like it's a
budget.
menu. Yeah.
Yeah, exactly. They add to the menu and then a provider like us, we go into a portal. It's called Promise. It's a billing portal. And then we put in, how many hours someone worked, and then that's how we get paid. So that's
Okay, so
kind
it's
of how
all
we,
done. The parents don't get this big check and then they have to. All right. So it's like similar to getting your service provider stuff done. They bill whoever promised through the billing thing, and then they get paid directly. The parents don't do that, but the parents have control in choosing what services that they want to choose,
Mhm.
knowing that you're going to go without if you choose this. So understanding your options is one of the most important things you could do.
Yes. And also, the services, they are based on the person's needs, so so if someone wants to attach speech therapy, but that's not really a need for them, there is an approval process. The county has to review those requested services and approve them or deny them. So
Right.
so obviously you want to make sure that whatever you are requesting really is truly needed.
Yeah, well, and that's the thing. I mean, what I want for him for versus what I want for myself even, that's a big weight. And from a conversation this morning, a friend of mine is now getting paid to care for her son, but after what she's getting paid for, there's not much left over with
Mhm.
funding for other services.
Yeah.
But now she's his caregiver. So, I mean, you got to pick and choose, do you want other things or,
Mm.
how, but I don't know. It's
Yeah.
just, it's a lot. And
Yeah.
that's why the service coordinators are there to help, right?
Right, exactly. And
Okay.
someone can change their services at any time. Like if you have respite in your plan, and you're like, oh, I haven't really used it. And I could really use more companion care or in-home and community supports instead. You can ask your SC like, oh, can you take this out? Can we add more of this
No,
instead?
it's like changing an IEP.
Exactly.
Exactly. Okay.
Yeah.
Well,
And
and if
all,
anyone's ever gone through that process, which they would have if they're using the services, I mean, correlating those two situations
mhm,
is
yeah,
important.
yeah.
Okay.
Mhm,
So Social Security, in addition to a waiver, was what we talked about last time.
mhm.
And really, with the counties, do you see any major differences in how they do things, or everyone's pretty much the same, but they just might have different acronyms or very small differences in between things?
Um, I would say for the most part, there's differences, not so great that they're like glaringly bizarre, I guess, for lack of a better word.
Well, yeah, I mean,
Um,
because if you go
yeah,
from here to New York, things are completely different.
yeah, right.
That's obvious. But if you're
Yeah.
in Pennsylvania and you're going from Luzerne County and you move into Lackawanna County,
Hmm.
not crazy different, but there might be some differences.
Yeah, maybe some little differences. There might be one or two that might do some like processes a lot different, or stuff that has nothing to do with waiver funding a lot different. But I would say for the most part, nothing too like crazy.
Okay.
Mhm.
So the first step is, if you haven't done it already, go to your local MHDS or whatever the acronym is for your area to do an intake form, and they will connect you with a service coordinator, which you could be on a wait list or not. Either way, you have to do that. And then that person and in that field will help you get to the waivers. And then once you get the waivers, then they can start using services like OneWell and others, in the community. So if anyone has any questions from what we just talked about today, you can always email Parenting Autism United by going to our website. Also, you can always go to the OneWell website. There's an info at email there that they can send questions to. But really, you have to start with start where you're at. But if you're not getting the help you need, the biggest thing that my takeaway from this is find somebody who will. You can't just stop, right?
Mhm.
So, any other lasting words before we're all done for today?
There is, and you might already be familiar with it, the Gold Book. Have you heard of the Gold Book?
I'm intrigued. I don't know what you're talking about.
Okay, it's amazing. It's very long. It's probably over 200 pages. The newest version came out in 2023. If you just Google the Gold Book, 2023,
Okay.
it'll come up. So it was written by people at ODP at the state along with parents. So it literally goes over every single thing, but it's in like amazing, like normal terms,
Oh,
not
this is huge.
jargon, like
Is it on Amazon? Like, how do
it's
I get it?
it's electronic. It's not like a
Okay.
physical book. It's electronic, but yeah, just the Gold Book 2023
Okay.
will come up. It's definitely, it's long, like I said, but it's definitely worth reading.
We will put a link to that on our website specifically,
Yeah.
just so that people have that resource and don't have to look up the Gold Book.
Yeah,
So,
it really is honestly helpful, and it breaks everything down where it's not like all the, every field has its jargon. It's not that.
well, and I used to send people to Autism Speaks website because it helped me with the first 100 days of the diagnosis. But when I did it, that was the only one. Now they have like 15 different, and I haven't looked at it in a while, but the first 100 days of X, Y, Z, A, B, C, D, E, F. So, but also it was so general, it didn't go by state. So even though I was reading it, it was like, or we're in Northeast PA, it wasn't something that I had access to if I was in Philly.
Mm.
Even though I was in Pennsylvania, it's like just, and there's a lot of people that we get calls from in where we're located who are in those extremely rural areas. And they're not going to have these services just because where they live. And there's 9 out of 10 times they're not moving and they don't have that option to move. So getting this information and being able to access it when you can understand it is exactly what we're doing this for, because I felt like if I could have gone back to school, I would have, but that was not going to happen. But you have to be able to educate yourself and understand it. And for whatever reason, and I don't know if you guys see this, but I'm assuming it happens in professional settings as well. But with parents, you'll say, "So do you understand everything that I just said?" And they're like, "Yep." And then I would do it too. And then I'd get in the car and I'd start Googling and then I'd forget what they said. And I was like, I don't know. I just, too much information. Keep asking questions. Stop somebody. Be rude. Interrupt somebody and say, "Can you explain what you just said? Because I don't know what you mean."
Yep.
Like, that is what I think a lot of people, they just don't want to come off as not understanding it, or maybe, they might feel dumb if they ask a question. And a lot of people don't want to ask questions ever, especially in a group setting. So,
Yeah. Mhm.
like in an IEP meeting, or if there was like a lot of people in the room. So I just encourage people to ask the questions, especially if you don't understand it. But I cannot wait to look up that resource and look at it for myself. So thank you for that.
Yeah, it's really helpful. And I mean, I've been in IEP meetings where it's like 20 people there, and I'm like, I don't even want to ask a question.
Yep, same.
So I get it.
Well, and I enjoy IEP meetings for a handful of reasons. One, when I worked at a school locally that was just for kids with autism, um, I was able to see different dynamics of the different IEP meetings, and the way that the parents came in really set the tone for things. And you have to look at it as a team. And
Yeah.
if you don't feel like you're part of the team, you need to stop that meeting and make sure everyone's on the same page. But I understand a lot of people just can't do that. They
Mhm.
can't stop it, but you got to. And that's why it's important to know where the resources are so that you can have people like your SCs there or an advocate from the ARC or from, C's of Lucerne and other places. Like you really just the more information that you have, you don't have to know the stuff. You just have to know the people who know the stuff.
Right, exactly.
So, all right. Well, we'll end on that.
Mhm.
And thank you guys again for everything. And this will probably lead into other things. And if there's anything ever big that you really wanted to like share, we can definitely do another one. And it can be 20 minutes, it can be whatever you need it to be to get that information out. And we would be more than happy to share it.
Awesome.
Awesome, thank you.
Thanks,
All
Lindsay.
right.
Lindsay, one last thing. I know you mentioned in the beginning that you had some questions about referrals to OneWell. So just want to throw it out there that if that comes up, anybody is interested in having a further conversation or would like us to talk to their supports coordinator, you can always reach out to myself, to Cindy, to Brandon, or that info@onewell.org email is perfect.
All right, wonderful. Yeah, so many people, their insurance companies require different things if
Mhm.
they're using their insurance. And then also, I just like everyone on my team, no matter who they are, to be on the same page. So if I'm talking to somebody at my service provider, which is Beyond Behavior, I'm going to say, listen, I'm calling MHDS and I'm going to, so that everyone on our team understands what's happening.
Yeah.
But I'm a team player, I'm a team person. So that's where I'm like, I'm on that. But getting the referrals to you guys. Well, yeah.
Yeah.
That's good news.
We're here to help.
Awesome. Well, I'm going to stop the recording. So hang on just a minute. But thank you guys again
Thank you.
for everything. It's exciting.